I know a lot of people aren't just gonna follow what their doctor says, or like no matter what you're gonna do, like you can't get them to brush your teeth properly. But do you think it would be like helpful if we had health initiatives that taught people how to like brush their teeth properly so that we have more preventative care and that like less people would have these problems and like fall in through the cracks and have to get root canals in the future? Because if we can teach them now and like even if only like 10% of the population chooses to follow through, like it's still 10% of the population doing it.
Yeah, it's a very interesting point because if everybody is doing the brushing, flossing, has a good diet, then you don't really need dental care unless it's like you are reaching the end of your life or you're elderly and just because of how your body changes as you age, like that's the only reason why you need dental care for. But the reality is that poor oral health is not just about brushing. We tend to think that if you brush your teeth, you floss regularly, you don't have to worry about any oral health problems. But we learned in my first year courses that your caries or cavities, they are multifactorial. So you can brush all you want. If your diet is bad, if you have genetic predisposition to getting cavities, no matter how much you brush, it's not gonna help you as much because you have an inherent risk because of your diet, because of your genetics, which means you don't your mouth doesn't produce as much saliva, so food tends to stay longer on the teeth, um, and that's how the bacteria is able to demineralize. If you're brushing too hard, you may see your gums start receding and you see more tooth structure coming out. So that's another problem if you're doing too much brushing. The other aspect is oral cancer. So smoking is one of the risk factors for oral cancer. And I know people, they like to think that dentists are just about teeth, but oral cancer or diagnosing and treating it falls under a specialty of dentistry as well. We can't say that, if we just tell people to brush and floss, it will improve oral health overall because there's so many different factors. We need to see what is the person eating? Are they having like chips or candy or chocolate or pop all the time? Do they have access to better food options, nutritious food options such as vegetables and fruits? There are different aspects to consider. Many of them are lifestyle based and are not necessarily related to oral hygiene that are important to consider when it comes to preventative aspect of dentistry.
I like how you covered all of those different categories because if we do look at the social determinants of health, there are, I guess, five broader categories. So there's genetics, behavior, which you mentioned before, medical care, social factors, and like physical influences, right? So it's nice that you mentioned like diabetes or like individual behavior as well as individual genetics. So thank you for covering that.
There's like a big difference between things that like people would not go to the dentist for versus things that people like have to go to the dentist for. Like for you, what do you think like procedures are considered like more urgent?
There is again a spectrum of things that are more urgent versus things that are considered more elective. So, for example, teeth whitening, as bad of an impact as it can have on your mental health if you have like coffee stains, etc. It does count as an elective procedure. Like it wouldn't cut the list if you were to prioritize the emergency cases versus non-emergency cases. But to me, like when I think about like urgent cases, if the person's in pain, that is an emergency no matter what you see clinically. So but when I say see clinically, like what you see in the person's mouth, if they are in pain, then there's something wrong that needs to be addressed. If one person has pus oozing out of a tooth and it's going into their mouth, that is urgent to address. This is like an interesting case we learned about in one of my courses where this one person showed up to the emergency of the hospital, not the clinic, the hospital emergency, and they were having trouble breathing and they had like a swollen neck. And after doing like the initial checkup, they called the oral maxillofacial surgeon, which is a subspecialty of dentistry. and that person had to come and drain their neck because they had one of the teeth infected, one of the lower teeth, and that infection had spread to their neck to the point that it was pressing against their trachea and they weren't able to breathe anymore. So that is an emergency because that person could literally die from not being able to breathe, right? So that is another emergency. We wouldn't think it's dental related, but hey, the infection originated in the tooth that should have been treated earlier on before the infection spread to that point. A lot of infections in teeth should be treated as quickly as possible because they can spread to your eye, they can spread to your brain, they can spread to your heart, they can block your airway because a lot of your vital organs are very connected to your oral cavity, and that's, I think, something that we tend to ignore. So oral health is not like you don't put your mouth on the side and then forget about it. It's part of your overall body and should be treated as such.
For emergency cases like the breathing problem, is that covered by OHIP?
So these cases are very rare where the infection spreads to the point that it blocks the airway. But under the OHIP, I know for Ontario, all the emergency or hospital-based dental care is covered under OHIP. So that means if a person has been in a car accident and had, for example, they broke their mandible or dislocated their jaw, that falls under hospital care, and that will be covered by OHIP, even if it's like an oral and maxillofacial surgeon, which is a specialist that you become after dentistry.
That story was actually insane. I've never heard of a dental emergency to that level, honestly. For myself, I haven't heard about a story like that. What would you say to regular individuals or patients to basically promote the idea of doing regular dental checkups?
Yeah, so like I said, like these cases are rare, but that doesn't mean they never happen. They do happen. That's why we have case studies, because we need to learn how to manage them should they happen in a clinical setting. I think my message to people from the general audience or people who are not experts in oral health or health overall, I would say that uh, if there's pain in your tooth or if you feel that there's something wrong with your teeth, and a lot of times pain is like one of the first symptoms or signs that you see, don't take it too lightly, because if there's pain, that means there's something wrong and your body is trying to tell you that you need to address something that's hurting. So don't take things lightly, and because the more longer you wait, the worse the condition gets and the more expensive it gets.
I think that's a really good segue to our next question. So, what would you tell people that think dental care is a luxury and not a need? And what side of dental health have you seen that most people don't?
As a dental healthcare professional, as a dentist, this is something that is going to be a lifelong journey for me to tell people that anything you do to make sure that your oral cavity is in a good shape and form is you taking care of your overall health. It's interesting because I recently wrote a paper for one of my courses where the case that I put together was that oral health cannot be addressed in silos. And one thing that I talked extensively about was nutrition and oral health, and how the oral health affects nutrition or the kind of foods you can eat, but the kinds of foods you eat also affects your oral health. So there's like a cyclic relationship there. We know nutrition is important for the overall body, and if nutrition is affecting oral health, how can they be so disconnected? So to me, it makes sense now that I've learned so much in my first year, but I didn't know how the oral cavity fits in the entire body. We've had so many studies that have linked periodontal disease, which is periodontium is the structures that hold your teeth in place in your mouth. Any disease associated with that structure has been associated with diabetes, heart cardiovascular disease. Recently, there was a study that showed that people who had poor oral health, they were more likely to see worse COVID-19 outcomes as well. So I'm not just talking about chronic disease, I'm talking about susceptibility to infectious diseases as well, or the outcomes of infectious diseases. And again, these studies are association studies that could mean one is causing the other, or there may not be any causality. I think that's important for me to point out here. But we've seen a lot of studies that show associations. And I already mentioned the mental health or like the social aspect of oral health. Like your smile is the first thing that people see when they meet you. Not in COVID times because everyone's wearing masks, but in non-COVID times, right? If I'm going for a job interview or if I'm working in retail, my smile or if I'm work is very important because that's what, that's basically what the company is putting out when they're hiring me. Or if you're working in work where you really need to have like a nice smile, you need to like look put together. Maybe if you're working as a receptionist elsewhere, you're working as a server. So like your employability is also affected by how your oral health is or how your teeth look. If you have crooked teeth, you are less likely to be employed. There's a study on that which I can share if you're interested in. So I think if people think that dental health care is a luxury, not a need, I think we really need to determine which, because it's a spectrum again. Right? I mentioned that there is the cosmetic part of it, and then there is the emergency. I think we can't just put everything in the same basket and say that it's a luxury when people are ending up in life-threatening conditions because of oral health neglect.